Hi, everyone. Thank you so much for joining us. We're going to give everyone a couple more minutes to sign on, so thanks for your patience. And we're going to go ahead and get started. Thank you so much for joining us. Today we're going to be talking to Paul Alt and Jim Munroe about the Department of Veterans Affairs Healing Environment Design Guideline. Thank you both of them for joining us. Give a quick introduction for everybody. My name is Madison Hammond, and I am a policy analyst with the Illinois ACEs Response Collaborative at Health and Medicine. Health and Medicine is a convener of the Response Collaborative, which is a multidisciplinary group that utilizes the science of ACEs and childhood trauma in an effort to create transformation for policy and practice. And this is going along with both research and the practice in organizations, hospitals, health departments. So, we are the lead convener of the Illinois ACEs Response Collaborative, which is a backbone organization. So we know that no single organization or sector builds community resilience. Therefore, we are a mobilizer, an advocate to create the systems level change, like what you're going to see here today. You can visit our website for more information, which includes policy briefs, environmental scans of trauma-informed programs, resource library, as well as our webinar archive. The collaborative would like to thank a few of our sponsors, the United Way of Metropolitan Chicago for its partnership, and the following funders who support our work: the Illinois Children's Healthcare Foundation, Crown Family Philanthropies, the Sprague Memorial Institute, and Intelligent Community Initiative. If you have any questions during the webinar, we encourage you to type them in. It's a little box right on this side. Please fill those in as it happens. We are going to have a Q&A session at the end. So if you have any technical issues, there's the number you can call for support. After the webinar, you're going to receive an evaluation survey, ways you can participate in the collaborative, as well as links to materials and a recording of the webinar, as well as some slides. So to introduce our speakers, we have Paul Alt and James Munroe with us here today. Paul is an architect and the founder of the architectural practice Alt Architecture and Research Associates, AARA, in Chicago. His firm's primary focus is the establishment of a collaborative of architects, veterans, and behavioral health researchers and healers in creating, quote, architecture as a communal tool for the healing of the mind, body, and spirit of a veteran. AARA was founded in the wake of a design project focusing on the healing environments for PTSD and loss for schools in both Chicago and the Bronx. These environments were planned with the help of students, teachers, and community members, and were to be tools for healing, experimental education, and community building. So based on these ideas, he utilizes the same vision of physical environment as a tool for healing in his work with the Department of Veterans Affairs. Projects have included the Healing Environment Design Guideline, which you're going to hear about today, the construction of the Veteran Memorial Building in Cedar Rapids, Iowa, and consultation on the master plan for the Green Road Project at Walter Reed National Military Medical Center. He's also joined by James Munroe, a licensed psychologist who's worked with the Boston VA healthcare system for 35 years, specializing in post-traumatic stress disorder in combat veterans. He is a subject matter expert for the Healing Environment Design Guideline. He has served as clinical director for the Veterans Improvement Program, director of PTSD Outpatient Clinic, and site training director for the Psychology Internship Program. He developed non-stigmatizing approaches with Iraq and Afghanistan veterans to reduce stigma and improve access to VA services. He has also worked with the American Red Cross for 15 years and served as a co-lead for the Disaster Mental Health Team and as a member of the National Red Cross Critical Response Team. He has been an assistant professor of psychiatry at the Boston University School of Medicine and authored numerous works on the effect of trauma on veterans and their family. And so thank you both to Paul and James for joining us.
You're
Thank
welcome.
you for having us.
And if you are a tweeter and would like to see what we are tweeting about, we are tweeting about this webinar at hashtag Illinois ACEs. So please follow along and please add your own tweets. So now that I've given a plug to our technology, I'm going to hand this over to Paul and James. Thank you so much.
Thank you. So for many of those who are on the call who don't understand how architecture can make a difference in healing, our work at Alt Architecture and Research Associates, this is basically 25 years of work in which I've worked with multidisciplinary teams to look at healing, community building, and experiential education. And this program began with school children in the city of Chicago, in Benton Harbor, Michigan, and the Bronx, New York, so K through 12, and then continued on to working with veterans from essentially the Vietnam era conflict to the current conflicts. So the Healing Environment Design Guideline is kind of a therapeutic textbook, and what it's essentially going to guide is the design and construction of all VA medical centers, outpatient clinics, and long-term living facilities. My direct client, Gary Fisher, healthcare architect in charge of all design guidelines for the VA, and I began discussions as I was on a think tank called the Epidaurus Project at then the Bethesda Naval Military Medical Center. But the guideline is meant to be read by medical providers, by veterans, by mental health experts, facilities people, architects, and engineers. So it is meant to foster collaboration in these design and construction processes. The VA Healing Environment Design Guideline is about creating efficiencies for integrative care delivery by creating a mental health framework consisting of contiguous healing environments throughout the facility. So it's really about increasing healing efficacy. Next, please. And before I go into the precedents, which this is at DeSalvo High School, my team consisted of 39 subject matter experts, 23 veterans, 19 who were deployed. Jim Munroe from the Boston VA, Ann Berger, Director of Pain and Palliative Medicine at NIH, to other psychiatrists, psychologists, as well as even parents of veterans. So it was the power of the chorus that really has made this guideline so in depth and looking at how the VA is going to transform its facilities. So to begin with, the image that you see, this is DeSalvo High School. This is about 1994. Dr. Hamberlin's in the center there. He had a courtyard of 22,000 square feet full of peacocks, ducks, geese, chickens, and a goat named Miss Daisy. He utilized the animals in his gardens as therapeutic tools. However, despite all these therapeutic tools, DeSable High School was located in the middle of the Robert Taylor homes, which was the highest concentration of public housing in the world at the time. These populations, the youth, through different data, revealed that 1 of 2 of these kids witnessed a murder, 1 of 3 were victims of physical and sexual abuse. There had been no families in 5 generations due to policies that basically promoted the disintegration of families. So it was a school that was in dire need next. So I became involved with this school when an assistant principal, Connie Montgomery, I was making a presentation down at DeSable. I was working with kids at the Art Institute, and Miss Montgomery came up to me after the presentation and said, "You know what we need around here?" And I said, and I didn't say anything. I just thought to myself, like everything. And she said, "We need a space for conflict resolution. A lot of children are being murdered here." She led me to Dr. Hamberlin's courtyard. And needless to say, I walked in there seeing all these birds flying all around this magnificent tree and courtyard. And I said, let's try something without knowing really what I was getting myself into. I knew immediately that I had to form a team, a multidisciplinary team. One of the first people I found was Carl Bell, a child psychiatrist on the south side of Chicago. He was one of the first child psychiatrists in the late 80s to identify the Vietnam War syndrome with what the youth was experiencing. So we immediately formed focus groups and workshops. And this is Carl. Next, please. Also, in these workshops was a psychologist from the University of Chicago, a Jungian Freudian, Peter Homans. He was the author of The Ability to Mourn. He and I actually taught a PhD level course at the University of Chicago called Mourning and Monuments. My graduate work was looking at 3 contemporary Italian cemeteries and how they became tools for the resolution of loss. So this is very pertinent to that situation, as well as the veteran situation, as well as the current situations in urban war zones. People lose more than just friends and loved ones, family members. They lose a lot of other ideals like trust, love, in many cases, liberty. Next. So at the end of 3 months of focus groups and workshops, in which we had, in addition, we had ministers, we had artists, we had social workers, with my original group of 11 students, we came up with this design. So you have to imagine on the perimeter is the building that creates this courtyard on 4 sides. The model basically shows in the center a classroom, like peer mentoring room that sort of divides it into different elements. At the upper left-hand corner, or I'm sorry, at the lower part is where you see the northeast entrance, which was basically a place for sitting, for allowing conversation. It was surrounded by gardens and reflecting pools. The children would take care of all this. As we go counterclockwise, you'll see a performance space. In the upper corner on the right side, you'll see a ritual place for promenades. On the left-hand corner side, you'll see a commemorative space to the murdered children. We had stones of thoughts. Again, how did the children express their loss? You had a circular pavilion or seating area for allowing that peer-to-peer discussion. Table of memory to bring the flowers and the photographs. You cross a bridge, now going to the lower left-hand side, to a picnic area, to places of meditation and contemplation. Kids would often say, you know, if I just had a place to be alone to get my head together, maybe I wouldn't go out and hurt someone. So this further enhanced Dr. Hamberlin's vision of, one, creating framework, two, creating places for empathy, for consoling, for making. This would be full of art and performance. So making culture. This would be about doing biology or writing or poetry. So it forms three things, as well as a place the community could safely have communal events. Next, please. So that work there was the origins of the current work. And what you see here is an image of the Cedar Rapids Veterans Memorial Building that was completed in 2014. It was originally a City Hall Veterans Hall. As you can see in the photographs on the upper side, upper portions, you'll see the building that sits on an island engrossed in it, or basically engulfed in a epic flood in 2008. We worked very closely with Michael Jager, the executive director and of the Cedar Rapids Veterans Commission, as well as the whole commission, to develop basically what became the largest community-based veteran center in the country, in which behavioral health was part of it. Physical therapy would be part of it. Community events. They have weddings 3 out of 4 weekends a month, as well as theater and performance. There's a veterans art studio, there's a conference center, there's a restaurant. Next, please. As you see kind of in this image, and it's called the building section at the lower right-hand side, essentially what we did was created, again, a series of spaces that would work together to create, again, these different communal events, which is therapeutic for veterans, because the veterans ran the building. As you see in the images in which, if you look at these series of 12 little images, in the lower part, you'll see that we actually created rooms. There were conference rooms that could also be places for writers' workshops, for one-on-one therapy, for meditation, for contemplation, for writing your thoughts. And then the upper images there, you see the befores and the afters of the flood. To the left-hand corner, which is the entry to the building, is the memorial room. That's the first, or that's the only stained glass window done by Grant Wood. So when you enter the building, the veteran in which that window is basically dedicated to the veterans lost from the revolution of World War I, since the building was originally constructed in 1927. In the lower corner, you see that there's a women's Iowa Gymnastics Championship. It was the first event in the building. So it's about community. It's not just about individual kinds of therapies, but again, we cannot heal in isolation. We can only heal in community. But these, again, therapeutic rooms that are for behavioral therapy, it's integrated into many other types of rooms that reinforce, create trust, create that empathy. Next. And this is just more images of the same. You see the lower auditorium, which is the conference center, and those images on the top. You see a conference room that sort of highlights, the more therapeutic aspects. Next, please. And then this one we just sort of added, but this is the Patriots Casa at Texas A&M. It's the first standalone veterans center for an academic center. The previous Cedar Rapids project was a $20.4 million project. This is a $5 million project. We collaborated with a local architect and worked very closely with General Rodriguez and Richard Delgado and his military affairs committee in developing this project. But you'll see the floor plans essentially there, and then we're going to kind of go on. But if you look at the second floor plan, which is the image to the floor plan to the right, in the purple is a basically behavioral therapy clinic in which civilian psychologists would be trained working with veterans who have experienced the hidden wounds of war. But around it, on the right side of that center, you'll see a veteran lounge. If you go to the left of that, you'll see a very large space, again, communal space. It's kind of a waiting room. If you go to the floor plan to the left, which is probably where we should have started, again, along the pink, it's all about, on the left is a big lobby area that's also an art gallery, which you'll see the images above. You'll see a commemorative space in which they bring the objects of war for display. That's the Veteran Art Gallery. And to the right is a ceremonial room with a real fireplace. So it's again allowing spaces to flow and activities to flow from space to space, and creating this sort of, again, contiguous environments for events, for therapies, for education. We've tried to get away from the hallway. Next, please. And this just shows some of the images of the constructed work, which, again, completed in 2014, like Cedar Rapids. Next, please. So, again, getting back to the guideline. So, but that work was the precedent. And again, the power of the chorus, 5 consultants, 39 subject matter experts. And again, a great client, Gary Fisher, who, again, wanted to create an unprecedented document to guide essentially the design and construction of VA facilities. Next, please. And this is actually a quote from Gary Fisher. And again, the generator of this was the Office of Patient-Centered Care and Cultural Transformation. And the VA has active programs in about 18 VAs throughout the country, in which the Office of Patient-Centered Care and Cultural Transformation is playing a big role in the programming of those VA facilities. Next, please. So, you know, you start, well, what is a healing environment? And this is the only thing that I'm going to actually read. So, a healing environment. The word healing is derived from the Anglo-Saxon word halen, which means to make whole, sound, and well. Healing is a comprehensive repair effort that requires the unification of the body, mind, and spirit. The healing process often involves gradual functional improvement that happens with a combination of ongoing professional treatment, community support, and therapeutic environments. The healing journey of a veteran involves a regimen of therapies and human interactions. It is a collaborative effort between veteran and veteran, veteran and family, veteran and healthcare providers, veteran and the surrounding community. Healing does not occur in isolation. It is realized in a supportive community. And I want to emphasize this guideline could be utilized in civilian hospitals, schools, mental health facilities, correctional facilities, as well as community centers. this guideline really is the gift from the VA to its society. And there's many lessons learned that can be, that VA has active behavioral health programming that can be applied to our urban populations that's in the midst of an opioid epidemic, as well as urban violence epidemic. Next. So we created 7 design principles, and I'm going to go through this very quickly. And the first design principle is provide a therapeutic environment. The image you see there is actually at the Milwaukee Soldier Home, which is now the Zablocki VA. This was taken right after the Civil War, where they had an Olmstedian park in which there was activity. We're talking therapeutic in the sense of active, not just passive, which is usually associated with these healing gardens where essentially everyone goes out and has their lunch. What we're saying is we create a therapeutic environment as a tool for healing programming by creating a therapeutic framework. Next. Second design principle, create a veteran embracing environment. So people become vested when, and I'm saying patients become vested, when they feel part of the facility. So we looked at ways to deinstitutionalize it, to allow for veteran, basically, personalization of the space through art, through being part of the design process, through, again, collaborating with VA personnel. Next. So the third design principle, provide direct connections to nature. 2 evidence-based design principles that were developed by Roger Ulrich, and data says use of nature and the inclusion of sunlight actually improves healing efficacy. So we looked at everywhere where we could do that. Next. And the fourth design principle is, the VA has hospitals and facilities in every state. Every region of the country is different. So we recognize that each VA, it's not going to be like a McDonald's, you plop them down. It, in fact, has to incorporate its surroundings, which gives a feeling of comfort. Again, stress is the origins of disease. So we found every way in which we could de-stress a patient such that by the time they get to that medical appointment, that they're relaxed and the medical provider can actually work with the patient. Now, we'll talk more about that later next. And the fifth design principle, patient-centeredness. So this is why these institutions are there. And obviously, the more you center care, personalized care, you're proactive and you're patient-driven, the more effective the facility, the more efficient the facility will be next. And then a safe and supportive environment for VA staff. There's a lot of issues of burnout, of retention of staff, and in the future, a shortage of doctors. So to retain staff, to make them more efficient in how they can help, do their patients, we have to look out for them too. And we have to create an environment that is therapeutic for them as well. Next. And the last principle is about technology. So how technology can benefit the patient in the healing journey. So how they can have access to their own information to help them in their healing next. So this is just basically showing the scope of the guideline. There'll be several future versions, but we covered entrances, main reception lobby, waiting areas, connections and pathways, mental health, spiritual spaces, courtyards, and exterior components, small waiting rooms and spaces of respite, cafeteria, cafe, women's clinic, multi-purpose spaces, and inpatient units. Next. So we start at the beginning. Again, how can you de-stress a patient after they've had potentially a stressful commute? Also, maybe they're bringing in stress from family or job situations, or even having stress knowing they're going to a medical facility. So we create areas at the entry which allows people to sit down, there's sunlight, there's water, there's gardens, such that this is the tone we set. Next. And now these diagrams that we produced, these are diagrams. These are not final designs, but it's to give guide. It's to help, again, architects, engineers, veterans, and medical providers basically where to start. So these are diagrams that we produced, but these are no means the final design. But as you see here, where the car drop-off is, and we're showing these sort of contiguous environments and these possibilities. So you have the car drop-off, and we come into the main reception lobby. And that main reception lobby is a place of orientation. So wayfinding is very critical. And one way to wayfind is to see where you are in relation to the outside. And you have, so you have this courtyard next to it, which again is a therapeutic courtyard. You have an immediate access to a stair. The elevators are there. You even have a little fireplace. Places, a choice of sitting arrangements. And where there's panels that prevent that sort of back-to-back thing, so you feel protected. Panels that are 54 inches high. So post-traumatic stress disorder and other kinds of stress is made worse in these in waiting rooms and in reception lobbies when they're crowded, when you're sitting back to back. But we give you choices of sitting. Next. So this also pertains to the same waiting areas. So next. But we create different, again, possibilities. So you'll see that two areas within this sort of waiting area is very similar to Cedar Rapids, where there's potential for one-on-one discussions with a friend or family member. It could even be a peer or a spiritual guide. So it's about de-stressing. And again, such that the medical appointment is more efficient. But we make the waiting areas a therapeutic environment, not a container of human bodies, which most of them are in private and public hospitals. Next. So again, that journey that through the connections and pathways, the hallways. This is a single loaded corridor. This is a great example of a single loaded corridor where you have waiting areas that are actually in the hallways. Again, we looked at 9 VAs, about 12 private hospitals, and 3 Defense Department hospitals. You look for best practices, and there's a lot of good stuff out there. And that's incorporated into the guideline. Next. And there's an example, again, of a waiting area that's also adjacent to a corridor, create little niches for seating, as well as actual access to the outdoors. Next. So, you know, in VA situations, there's a lot of veterans who lose people. And they've left people behind in deployments in the battlefield. And this is something that Jim's going to actually address. Jim, why don't you, I'll give it to you.
Okay, very good. An appropriate slide with the Vietnam Memorial here. Paul contacted me some time ago in relation to some published material on our program for combat veterans of Vietnam. And part of what we developed was an annual trip to the Vietnam Memorial with our combat vets. And he contacted me because I was using architecture as a healing environment. But it goes well beyond that. And while Paul was talking a lot about, the de-stressing, it's important to realize that the healing environment is not just nice and relaxing. It can be an active part of the treatment, incorporating components of that treatment. The wall was a great example. PTSD has not been around that long. We're still developing treatments. One of the problems with some of the treatments is they don't address issues such as grief, loss, or moral injury that goes along with war. To be able to go to the Vietnam Memorial, it is a sacred space, and you can feel that if you've been to the memorial. So we were able to take our veterans there to use it. We would bring them first thing in the morning, very early when it was dark and there was no one there, which was very powerful. Then we would bring them back a couple of times during the day when it was crowded with people and school children. And that whole sense of community healing that Paul's also talking about could happen there, because we had to build a strong, tight community with very untrusting and angry veterans before we even attempted to do this trip. And everyone was well known and well prepared to make the trip. So that component of community was built in, and that was from our space that we had back at the VA, but we moved out to this safe space and were able to use that. That allowed us to address some of those issues that just don't seem to get covered. People could put their name on their finger on the name of the wall and tell us about that guy and what happened on that day, and do that as a group. People would go up and look at it individually. We'd meet small groups. We would always, after we left the wall, meet in some place, which was almost always outside in nature, at a VA facility or a military base, to talk about what we had just been through. So it's a nice, safe place, components of nature. Of course, I hadn't read all of these guidelines before we did that. This was more created by the vets and the staff trying to work together at the process of healing. The creation of PTSD as a diagnosis legitimized the symptoms, things that veterans were going through in a way that they wasn't real before then. So suddenly now it was real. Also gave them a bit of a stigma, and there weren't any treatments available back then. But that's fortunately being developed even more and more these days. The spaces, the architectural spaces and the spaces that Paul is talking about, and I'm sure he'll go back and give you some of the specifics. These can be built into treat. These spaces legitimize the use of them and the issues they represent. For example, the wall.
Maybe the slide goes next, Jim. Maybe. There we go, Jim.
Okay, so all of these different spaces can be used in different ways. The wall legitimized grief and loss and said, yes, this is part of the issue. This is what we need to deal with. It's part of the treatment and the healing. Some of the other spaces that Paul's going to talk about have pavilions that are outside. They have memory boxes for items. For example, if all people would leave items, there's some pictures of this later. They would leave letters. These spaces being built into the VA give clinicians a whole different way of going about how do you treat certain issues and how do you deal with grief, loss, questions of spirituality, moral injury. The existence of these spaces legitimizes those as issues and also gives new possibilities to do treatment in different spaces. You can do your regular stuff in a office, but now can be other options where you can do different kinds of treatment for both on an individual basis, small groups, or incorporating the community. For example, when we went to the wall, all the people visiting during the day became a community because they cared about what was going on with the wall, with the veterans. And it was extremely helpful for vets to see that community come together. They would even interact with people before they, would run away. They didn't want to see anybody. So, Paul, I'll throw that back to you. I know we're getting a little bit short on time here.
Yes. So this is kind of the DeSable application. This could be an atrium. It could be a courtyard, depending on the climate. But you see the perimeter, again, has those different waiting rooms. There's a chapel. There's a commemorative pavilion. There's a peer mentoring pavilion. There's a place for ritual. And then on the upper right-hand side is the mental health clinic. So again, it may not be appropriate to do it in an exam room, a treatment. But if you have a menu of choices, and this would be complementary alternative medicine working with mental health. But again, the patient could be going to a chemotherapy. You could be going to a diabetes clinic. You could be going to an addiction clinic, as the main appointment. Again, if you can de-stress a patient before they get to the main medical appointment, that medical provider can make that appointment, instead of 50% efficient, trying to get someone to calm down, to 90% efficient, you shorten the duration of treatment, as well as making the healing efficacy higher, and then you shorten lines, and you can see more patients. Next, we'll hurry up a little bit. So this is just an example of a mental health clinic that we took the basic one that the VA had and made it, again, more therapeutic. Next. This gets to some of what Jim's work is, and Jim's work was so important to this guideline, but shows basically from that one on the left, that's actually Jim's photo, but he also, below with the Lincoln Monument, he made that part of the journey, and Jim, I don't want to take this away from you, but it was about incorporating culture, our common culture, as a means of part of the healing process, which is our community. Next. And again, the ritual involved that Jim's work was so important to these veterans. It became a way that the veteran could transcend, again, his or her personal issues, and began to look outside themselves. And this is in many conversations. Next. And again,
and just a quick comment here, Paul, that all of that stuff that you saw at the wall and the healing potentials are brought to the VAs through this design system.
Yes, I mean that. Again, Jim's work is in the guideline, and this on the left shows this was part of the master plan for the Walter Reed National Military Medical Center, which we're credited with the master planning work with some other landscape architects. The pavilions you see were not constructed, but shows the ideas in which were very helpful for the guideline, especially the hidden wounds of war, peer mentoring, commemorative, spiritual, meditative aspects. Next. And again, part of that guideline, which our work with Cedar Rapids was, we built these projects. They're operating. And it's from that experience that also enriched what we were doing with the guideline. Next. And then we looked at cafeterias. Again, How do cafeterias become not just a place to go get food? This is actually quite modeled after Lurie Children's Hospital, which is a wonderful hospital for many aspects of therapeutic space. Next. And then an important part is peer mentoring. And we found Bob Curry and Mark Flower up at Dry Hooch in Milwaukee, in which they have an amazing tool. Again, you find people suffering from trauma will open up to a peer faster than they will a professional mental health expert. And so there's a huge role now of peers in the VA. Next. And this shows kind of a diagram of typical cafe where you see seating and this and that. And then on the sides are two peer mentoring rooms that also allow for more meditative or writing kinds of workshops, similar to Cedar Rapids. Next. And the women's clinic was so important. And our women veterans contributed, obviously, only what they could contribute to versus a man. And this is the one up in Zablocki, run by Colleen Henkel, where they actually took Zablocki is a huge VA. They took some former physicians' houses and they made it into a woman's clinic. Next. With details of the images on the right showing the interior. It's just a fabulous place. Women feel safe there, and they feel that they can obviously get their care next in an efficient manner. Also, and this ends the guideline, and we're going to go very quickly into civilian applications. We said that post-occupancy exams of what or how you view a facility afterwards should be reinforced by scientific research. So we looked at a way of introducing measuring healing efficacy in space through genome, through sweat patch, heart rate, as well as narratives. And we had amazing researcher input on this. Again, from Perry Skeeth, from Ann Berger at NIH, in which we created the possibility. And again, it's not looking at one isolated space. It's looking at a healing journey through contiguous healing environments and integrated care delivery. So not integrated care delivery like you're on the 10th floor, 11th floor, 12th floor, where the medical providers can't collaborate really, but we create this sort of central space, that courtyard space or atrium space for collaboration. Next. So we go to Chicago. What you see here is essentially the different stars are medical facilities. The dots are opioid overdose deaths. This is 2016. And then you see this green stuff. Well, that's the Cook County Forest Preserve. And of course, there's the Chicago Park District. There's Chicago schools. There's a real opportunity of creating a healing environment master plan for the entire city where, private institutions, public institutions collaborate. The infrastructure, you're creating a healing infrastructure instead of working in a silo, which so many hospitals do. But to bring together the city, the county, and the state, and private institutions, that's what the Burnham Plan originally did for Chicago, was creating these spaces of leisure and healing. Well, now it's all there, but now we got to tweak it. Next. Here's an example of the Cook County Health System outpatient clinics. There's 6 medical centers with 14 outpatient clinics. The red is the urban violence. Those are the murders that happened in the city of Chicago. Again, this is 2016. And you can see that the centers, the outpatient clinics, are primarily located in those high violent areas. But, you know, the spaces that they have really don't address the hidden wounds, the PTSD, the moral injury, the loss. They just, the environments there, you know, could be out in the suburbs of the far western suburbs. And again, what the guideline could aid in is in the reconstruction of these facilities. Next. One current project we're doing with the Institute of Medicine of Chicago, Cheryl Ermitter is the executive director, is that we're looking at bringing healing environments and healing programming directly to inner city schools. The Marine Leadership Academy is located in Humboldt Park. In 2016, there was 28 murders and 168 wounded in this neighborhood. Next. And so we're looking at kind of a DeSable thing, where you see that sort of central courtyard as a potential environment. You see a cafeteria, basically with no windows. And then on the left, you see a garden area that could be also enclosed, and then there's a train track. So Cheryl Ermitter and the Institute of Medicine of Chicago and I, we began a series of focus groups with 60 students after a tragic suicide that happened in March. We knew that these kids would be facing a trying time as the weather warmed, as the killing season began. Next. And as you see here, the big red kind of star is the location of the school. The colored areas are basically violence levels. To the south of that school is Humboldt Park, where you see very high rates of violence. The school is also surrounded by 6 gangs, which is basically denoted. Oops. Hello?
We hear you still.
The image is gone, though.
Oh, can you see still, Karen?
There's.
Huh.
Oh, wait, it came back. Okay, I got it.
Good. And I do want to make sure we're cognizant of everyone's time. So
Yes.
We've got about 5 minutes left.
All right, we'll just go through the slides. We're almost done. So this was a locker room, basically, or a locker in a hallway of the student who took his own life. Next. And here's kind of an example, juxtaposing it against the memorial wall. Again, the counseling offices were basically overrun, high anxiety. It was palliative in the hallways. Next. And again, this is the workshops, again, the focus groups, in which the students actually constructed models, wrote essays, they did drawings. And this was after we presented the DeSable model and some of our work to begin the creative juices. It was stunning work by these students. You have such courageous students and staff in these schools, but they don't have the tools. Schools are no different than they were 150 years ago. An auditorium, a gym, classrooms, hallways, cafeteria. They need a lot more now. And school shooters, issues of violence outside of schools. That can all be addressed by healing environments and mental health programs at the school. Next. This just gives you an example of some of the drawings. Next. This is actual models that the kids produce. This is good as first-year architecture students in any university. Next. And that's the end. Thank you.
Thank you so much to both Paul and Jim. If you have any questions, please feel free to type them in. I'm going to start us off with one of our questions. And you've touched a little bit on this, Paul, with your talk about your work in high schools, but what are some of the different groups of people that healing environments can work for? And then a second part of that question is the VA is a very large organization. It's one of our largest departments in the government. So what work can smaller organizations and institutions do if they aren't able to, build a whole building? What are the smaller scale work they can do to create a healing environment?
Well, I think that the Marine Leadership Academy is one example, again, potentially of like a $3 million project, which is considered small from the standpoint of the VA. But you could do a healing environment in a classroom, a single classroom. And I think it really takes thinking of a master plan of whatever you do. Mm-hmm. Again, what's going to happen with the guideline, there'll be healing environment master planning. This is also something that we're in discussions with a private hospital system of doing with some of their outdated facilities. You have to
even with smaller groups in a school, classroom, whatever the situation is, incorporating some of these components. For example, you saw the kids doing the drawings of a memorial for themselves. The veterans that we had would personalize the space, and they would design things themselves that they thought were healing, and they would take over the environment. So it's great if you have it all built and it's there at a VA, but if you're in some small local area where there's been traumatic experiences for people, a place to get them together, some way of memorializing and making their own sacred space can be done as part of the healing process.
Exactly. I mean, even remember the desks in Cedar Rapids. The idea is those desks provide a place for personal objects. So when they're writing something, when they're praying about something, when they're meditating, so they can personalize that desk or that niche. So that's designed specifically for personalization. And that's what the architecture does. It gives it a framework, but it's the stakeholders who personalize it.
And another question we have about your work with the school kids. So you've done a focus group. What are you hoping to accomplish this coming school year? Or what are the next steps in Humboldt Park and beyond in other schools?
So we're looking at community focus groups, staff focus groups, and leadership focus groups with the Institute of Medicine of Chicago. And that will, once we complete that process, it'll lead to a conceptual design, which will then lead to an understanding of construction as well as budgets. But we've really created a template for all Chicago public schools. And there's certainly other schools in other urban areas that are even in more dire straits. But it allows the students to, again, invest themselves as well as the community. So we're looking at businesses to be collaborating with us. We'll potentially will provide employment as well as funding, sort of an endowment for the school. These are schools, at Marine Leadership, 90% of those kids are below poverty line. So unlike other Chicago public schools in Lincoln Park and the Gold Coast, where parents are contributing a lot of their monies to the school to allow for extra things, this will allow for school or for businesses to fill that role. But you got to give a compelling reason for it. And a student to learn to read and write cannot be traumatized, as well as for a person to hold a job. We all know what PTSD and moral injury and the other Hidden Wounds Award does to disrupt individuals and families. So the space environment brings those people together for a common cause, as well as to develop trust, empathy, and a common purpose.
Yeah, so it's really about making the whole community trauma-informed, building beyond the school, it sounds like.
It has to be. Otherwise, the kids aren't going to learn and to develop as whole adults.
Well, thank you both so much for this amazing presentation, and thank you all to everyone who has joined us today. We will be sending out, oh, there we go. Here's, for more information, our contact information, as well as our website, our Twitter. We hope that you will follow us and look at our webinar collection, which this will be made a part of. If you have any questions or would like any more resources, please feel free to reach out to us. I know a couple of you have asked about accessing the guidelines. This will be made available through the slideshow, and we will also send out links in a follow-up email in the next couple of days, so please watch your inboxes for that. Paul, Jim, thank you so much again for this wonderful presentation.
Thank you for having us.
Thank you for having us.
And thank you to all of our audience members, and have a great day, everyone. Thank you so much.